Cindy, what brings you in today?
Well, I haven't had my teeth cleaned in a long time, and they are in bad shape.
Okay.
I noticed my breath was really bad, and my gums are bleeding and hurting.
Yeah. Okay, well, I'll let you know. My name is Natalie. I'll be your dental hygiene student today, and we're just going to talk about some oral hygiene care to get you cleaned up. First, we'll start. I'm looking at your medical history here, and you said you hadn't been in a while?
No, I had one of these teeth up here extracted like a year ago, and I haven't been since.
You haven't been since. Okay. So, we're just going to flip through this book right here. So, first we're going to start off with these caries. You know what caries are?
No.
Okay. So, caries is just tooth decay. Most commonly, that's called cavities. Have you heard of cavities? Okay. Prevention, you can just brush and floss. I know you said you don't like to floss very much, but it's caused by like soft drinks or energy drinks. I also saw in your medical history that you take a lot of medications that cause dry mouth, and that like reduces your salivary flow, and so that can also be a risk for caries.
Good to know.
I saw, looking at your mouth, you got some gingivitis. That's just like inflammation of your gums.
Is that why my gums bleed?
Yes, that is why your gums bleed. It's, look at here.
Oh, wow.
It's all red and puffy. That's again brushing maybe too hard, too fast.
I do like to brush my teeth very hard.
Yeah. Do you know what type of toothbrush you use?
Not the electric kind.
No, just a manual
It's
kind.
really hard.
Okay.
I want to get all up in there.
Yeah. Is it hard bristles, soft bristles?
Hard.
Do you know hard bristles? You like scrub it all off?
Yes.
Okay, we'll talk about that later. So if we can keep you here with your gums, we can kind of reverse this and make your teeth healthier. But those numbers, we used a probe to do your pocket depths. We saw like 6 to 7s in the back and 3 to 4s in the front. You want a 1 to 3 to stay healthy.
So we don't want them high?
No high numbers. The lower the better.
Okay.
So that goes into periodontal disease. There's different stages. First stage is gingivitis. I'd say you're probably in like a 2 to 3 range.
Okay.
Probably more 3. But those pockets is periodontal disease. That's basically just bone loss.
So we can't reverse this?
No, that is gonna stay where that's at, but we can manage it. We can keep it right where it's at. Just by flossing and brushing every day, you remove that bacteria that's in your mouth that's causing that bone loss.
Well, I don't like to floss. So
Yeah. I think there are
only brush my teeth like 2 times a week.
2 times a week. Okay. Well, we'll work on that. We'll find you different toothbrushing methods and a different toothbrush that'll make you feel better.
Okay.
But there are also different flossing methods that maybe won't hurt your gums as much for now until we can get regular floss in there. So what's causing all that calculus and the caries and everything like that is called plaque. That's just like the sticky stuff.
I do have
It's
that.
like, most people call it like fuzzy or hairy, furry. Some people call it like sweaters on their teeth. It's just that white buildup that goes
I
in your
definitely have
gums.
that on the bottom.
That's again just caused by sugary drinks, starchy foods, anything like that that's not too healthy for our teeth. And then if we get too much plaque on our teeth, we could start to build up calculus here. That's like the hard stuff that builds up. Sometimes it's yellow like that. Sometimes it can be darker or even black there. We can see it on x-rays. So if you ever get x-rays taken, we can see it there. Here, this is a before and an after picture. Just dental professionals like myself, dental hygienists, can clean that off for you. With your periodontal disease, I would recommend coming in like 3 months to 4 months.
Okay.
We'll just keep an eye on that, keep it cleaned up, and then to like make everything even better, we'll watch your nutrition that you're eating. So there's good foods like cheeses, chickens, meats, and nuts that are healthy for your teeth. And then like they always say, sweets like cake, cookies, candies are all bad for our teeth. There's soda, and if you do decide to drink a soda every once in a while, just maybe rinse with some water after. So, you said earlier that you use just a manual toothbrush?
Yeah.
Okay.
I don't really like the vibrating in my hand.
Yeah. Well, I would recommend maybe using a power toothbrush since you do have some shakiness with your hands. Those dexterity issues, it's a lot easier to brush. So that power toothbrush will vibrate for us, and so you just have to do our motion that I'll show you in a second.
Okay.
A lot of people say it's easier to use because of those moving bristles.
Okay. So I can't push as hard then?
No, a lot of times they have like different modes.
Okay.
Where if you put it on that setting, it'll tell you if you're pushing too hard.
Oh, that's nice.
And, you know, we brush for 2 times a day, 2 minutes every time. And a lot of these toothbrushes even have timers on them.
Wow.
Yeah. So you don't even have to use a watch or watch the clock or anything like that.
That's
It'll just tell you when you're done. And if we do have to use a manual toothbrush, I will say I do recommend the electric one, but we want to use a soft bristle.
So not the hard one?
No, those hard ones will make our gums hurt even worse.
Okay.
So now, when we do get the proper toothbrush that we want, we're going to use these toothbrushing methods. So I would probably recommend for you, it's called this Bass method. You start at a 45-degree angle at the gums, and then we do a little vibratory stroke, press very, very lightly, not hard like we're doing now, and then you flick down towards your tongue or up towards your tongue. So here in the back, it's going to look like this. 45-degree angle, vibratory stroke, and swipe down.
Okay.
And you go all around your mouth. And we do recommend like 30 seconds for each corner of your mouth. We'll make that 2 minutes. Same thing over here, swipe down. And then on the bottom, you're going to angle that 45 degrees down this time. Vibratory stroke and swipe up. It's just get all that gunk, debris, food, anything like that away from your gums.
Okay.
Did you know that you're supposed to brush the back of your teeth too?
No, I didn't know that.
Yeah, we do that. So when you're doing those, like up here and down here, you're going to stand up that toothbrush and do that same little circly vibratory stroke and pull up.
So always away from the gums?
Yep, always away from the gums. And then on the top, you're going to do the same thing and go down.
Yeah, when I go in there, I just scrub the...
Yeah, will you show me how you do that on this model?
When I go in there, I just scrub really hard.
Mm-hmm.
And so that's not the way to do it?
No, that's going to be way too hard on our teeth and our gums and cause more damage.
Okay.
Tissue traumas too. So, now that you've shown me on that model, I'll take that back from you. I'm going to give you this actual toothbrush, and I'm going to have you show me again how you brush now. And then I'm going to have you show me how I just showed you how to brush.
Okay.
There's that. Okay, show me how you brush now.
I just go in and go really hard.
Really hard on that hard bristle toothbrush.
Mm-hmm.
Yeah. All right. Now let's try that other method that I just showed you. So you go in, angle 45 degrees.
Okay.
And then wiggle, 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 and swipe down.
Okay.
And it's real soft.
Okay.
And how long was that supposed to be?
30 seconds on this side?
Yeah.
And 30 seconds on this side?
Uh-huh.
Okay.
2 minutes total. And then how about those bottom teeth on the back sides?
45 and flick up.
Yep.
Okay.
Perfect. And it's not just those front teeth. You'll do these like that too.
Go in and flick up?
Mm-hmm. Perfect.
Okay.
And the back sides of those molars too.
Same thing?
Yep. Same thing as the front side.
I think I can try that.
Yeah. Alright, so now we know how to brush for 2 minutes, 2 times a day. We'll do our flossing methods. I know you said that flossing kind of makes your teeth bleed and it hurts real bad.
Yeah, I don't floss very often.
No. So we do have like different types of floss that maybe don't hurt as bad, but we want to make sure that when we're doing it, you're not snapping it down in between your teeth, because that's probably causing more.
Why it hurts.
Yeah, more trauma to those tissues. But I will recommend these floss holders if you do start to like floss better. That really helps with assistance with your hand issues. You know, it'll get in your back teeth better. Or if you're on the go, there's these floss picks.
I've seen
that
those
are
at
really,
the store.
really nice. Yeah. A lot of people that are having issues with flossing, they recommend this water pick here. It's just a burst of water that goes in between the teeth. We do say that use this in conjunction with flossing.
Okay, I wondered if that would help with my bleeding.
Yeah, definitely. I think using any type of flossing will help with your bleeding for sure. But I will show you, I'll put another pair of gloves on, how I want you to floss.
Yeah, no one's ever really taught me the best way to floss, so I guess
Yeah.
I just
Haven't really done it much because
No.
you've never been taught. Well, that's good that I'm teaching you today then, huh? So, we start with this floss. You want to do it about 12 to 18 inches long. You start it on one finger and wrap it all the way up, like this. And then on the other finger, your middle fingers, you just wrap it a little bit.
Okay.
And then you wrap, and then on the bottoms, you're going to use your pointer fingers, push down.
Okay.
And you're going to seesaw it into your teeth.
Okay.
And on the tops, you're going to use your thumbs and go like that. So, I'm going to hand you this mirror. And I'm going to show you in your mouth how we're going to do that. And the reason that I'm wrapping all this floss in one finger is because we don't want to use the same piece of floss in between each part of your mouth, or in between each tooth. All that bacteria in one piece, we don't want to move it to the next one.
That makes sense.
I'm going to show you in these mid to back teeth here. Gonna seesaw it in. And not try to snap it in or anything like that. And then you form a C like that. You see how I'm bringing that forward? And then a C in the back. And that's perfect, just like that. So you want to roll that up in your fingers. And you want to try that? I'll hold this mirror for you.
So on my middle fingers? Here?
Yep, you can do that same tooth I just did.
Okay.
Seesaw it in, make that C, perfect. Wiggle up and down a little bit, and then do the other tooth behind it. Make the C, perfect.
We're stopping.
All right. So that's just gonna help with some of your bleeding, some of your issues when you're brushing. It's gonna hurt less because your teeth aren't going to be damaged quite as much. Just things like that.
Okay.
So, I did talk about this water pick. You can use that while you're flossing. You can like use a water pick one day and then floss the next.
Okay.
It'll help the...
I might have to get me one of those.
Yeah. Do you know if your toothpaste contains fluoride or not?
I don't know. I don't look at the ingredients. I just pick whatever's the cheapest.
Do you know what brand you use?
That Crest or Colgate.
Okay. Well, those are pretty good brands. Those are probably gonna contain fluoride. Fluoride just like remineralizes your teeth. It like makes them stronger almost.
Okay.
So we use this is a fancy word, dentifrice, but it just means toothpaste.
Okay.
Do you have any like sensitivity or anything?
No.
Okay. So if you did, I would recommend our Sensodyne here. I did note in my chart that you wanted some whiter teeth.
I did.
Yeah.
I do, yes.
Okay, so I will tell you, we'll get you all cleaned up first with a couple appointments, and then we can start using this Crest White. That's one of my favorite brands. It has a whitening formula in there.
Okay.
So you can start with that, but then maybe we can take some other measures to whiten up those teeth. And so I want to swing back to our medications that we talked about earlier.
Okay.
A lot of those are causing dry mouth. You ever feel like you got a cotton ball in your mouth?
I do. A lot of the time I do.
Yeah. So we recommend these mouth rinses that keep your mouth fresh and not so dry all the time. There's one special brand, it's called Biotine. It helps with dry mouth.
Okay.
So I would recommend that for you.
Will that help with bleeding too?
I would say no, probably not.
Okay.
The brushing with the soft bristle brush and the flossing will most likely reduce that bleeding index by a lot. I noted here that your bleeding index was a 55%.
Okay.
We like to have that almost all the way to 0 if possible.
Oh, so that's really high.
Yeah. Just like doing everything that we're supposed to, maybe implementing this mouth rinse will help more so with like your bad breath that you mentioned earlier. Yeah, so a lot of these you want to like make sure on the back that they contain fluoride because that's probably going to help you the most. You want to make sure you look at the directions on the back because some say like rinse for 30 seconds. Some say rinse for a minute.
Okay.
It just depends. So you want to make sure you look on the back. This is definitely not a substitute for brushing.
Okay.
So this would be after you're done brushing.
So use it with the brushing and the flossing?
Yes. It's just one more thing to add on to there, yeah. I did notice looking in your mouth earlier that some of these like teeth back here were maybe worse off in these teeth here. Again, those probing depths, the 6 to 7 millimeters, that could be another reason that, because we're missing those teeth.
Yeah.
Molars and your gums and that back sides of your teeth.
Yeah, I don't brush that area.
No. Do you brush your tongue ever too?
No.
No? Well, when you're done brushing your teeth, just take a couple more seconds and brush that tongue.
Okay.
And that'll get rid of a lot of the bacteria that's in your mouth, brushing that tongue.
And that'll help my breath?
Yes, for sure. And then, like I said, then you're done brushing and then you floss and then you use that mouth rinse will really help your breath.
Okay.
So, like I kind of mentioned earlier, we have this thing called fluoride. It remineralizes your enamel. Like when you eat anything, your mouth makes bacteria into acid.
Okay.
And then it draws minerals out of your teeth and makes them softer and not as strong. This fluoride replaces those lost minerals and makes them stronger. If you ever have any like pain or anything in your teeth, that could be a little bit of the reason why loss of minerals. But fluoride is in like food, it's in your drinking water, it's in that toothpaste that you're probably using. It will be in that mouth rinse that you start using. And also here at the dentist, we can give you a professional application as well. want to talk about is our xylitol. If you are like craving a little bit of sugar maybe, we can use this. Chew Spree or Trident or Orbit all usually have xylitol included. It's just like a sugar substitute.
Okay.
So research has shown that the use of xylitol decreases plaque, it helps you repair damage to the enamel, and it benefits your saliva. So if that dry mouth, you pop in a piece of gum maybe, if you like chewing gum, you use these brands and it'll help you out. So
that's good to know.
Yeah. So I want to go back to one more thing in your teeth here. I was talking about that plaque, and at your last appointment we did the plaque score, and it was all the way up at a 35%, and we try to get that one probably under 10% for a pretty healthy mouth. Again, that's just that white chalky stuff that gets built up, and when your mouth was all pink last time, that's what we were counting there. So just again, brushing and flossing will reduce all that for you.
Okay.
And then one more thing, I see that little mole on the other side of your face.
Yeah,
there.
it's been there for a while.
Yeah. Has it gotten bigger or anything like that?
Yeah, just a little bit though.
A little bit bigger. I will recommend that you go to a dermatologist and get that checked out. They'll just look at it, maybe take a biopsy of it.
Okay.
And they're specialized in something like that, so
I will
they
definitely
can
do that.
get you the right treatment for that. So, do you have any other questions for me today?
No, thank you for teaching me how to floss and brush my teeth.
Of course, and I can write everything down for you.
That would
you
be
have a
great,
little
so I
Post-it
don't forget
note.
it.
Yeah, and then you go to the store and get all those things to help your mouth feel a little better. Okay, well, Cindy, thanks for coming in.
Thank you.
Yeah, of course.